All right, I think we can get started. I'm Megan Morehauser, and I am the RAC Communications Liaison. And welcome to the Stakeholder Engagement meeting. Today we have two presenters, David Smith, who's with HICPUF. He's going to give us updates regarding the rule changes we have going. And then we also have Chantel Kalish from HMS, who's going to give updates about our audits, as well as she's going to go over the new website that they launched that we're all pretty excited about. So without further ado, I'll go ahead and jump in. Our next board meeting for the HB 23-1295 is March 12th. Everybody can register online at our RAC website. All the dates for 2026 are available on there to register ahead. The next stakeholder engagement meeting is May 7th, and that is up on our website as well. And you can register for the entire year. I wanted to do some housekeeping as far as I'm always trying to remind providers that the information for you needs to be current in the HMS portal as well as the Gainwell portal. Remember, those are two separate portals, and it's very important. I try to ask providers at least every 3 months, maybe, or twice a year, depending on the turnover and billing or such, to update all information, including the email addresses for who the point of contact is, as well as maybe mailing addresses and billing addresses. So if everybody could do that for us, that would be great, especially with the audits rolling out. Another thing I wanted to discuss is that currently with the new processes, we are not wanting checks to be sent to HMS or HICPUF. The new RAC program processes that have been developed by the department include changes to how the funds are collected for overpayments. So providers should no longer be mailing checks to repay the department for any type of RAC overpayments. Instead, the system is set up for claims to automatically adjust in the MMIS upon the conclusion of the audit. So any funds that are sent in it's screwing up the accounting aspect, and it could be duplicative for payments. So additional information regarding this can be found within the RAC letters that you receive, and it should be updated soon that we're no longer accepting checks. The complex DRG audit is going to roll out. It's looking to roll out in the next month, the next 4 weeks. So everybody can have information on that on our RAC website. Just a little update as well, since HMS just launched their wonderful new website. We will be mirroring that, and I'm working with a colleague on mirroring that website to update ours. And that should be updated in the next couple weeks since they just rolled that out. So look for those changes, and I highly recommend using both websites. So with that information that I have, just some housekeeping, I'm going to turn it over to David Smith.
Good afternoon, everybody. I'll try to make this less dry than a 7-grain loaf of bread. So my name is David Smith. I work in the Medicaid Operations Office. I'm really working behind the scenes on items that are of a legal and regulatory nature. As those of you on this call can guess, Senate Bill 314 really instituted I would characterize it as a fire drill for the resumption of RAC operations of the program. So behind the scenes, resuming operations included refiling the state plan amendment with our regulator, CMS. HICPUF actually does not do its work in a vacuum. We actually have a contract with CMS in the form of the state plan. So that was updated pursuant to Senate Bill 314. Uh, the contract had to be updated with our RAC vendor, HMS. I worked on that. But the RAC team invited me to come today to talk to you about the rule change. I think the main point that I really would like to underscore for this group is that the rule changes that were made effective January 9th before the Medical Services Board, on their face looks like we're making the process less fair by removing certain provisions, but really the goal was to remove conflicting provisions in the department's rules and defer to the provisions in Senate Bill 314. I think everyone here at the department and the stakeholders included would agree that Senate Bill 314 really establishes a much fair process for conducting RAC audits. So, there were provisions in our existing rule that were in conflict with Senate Bill 314. And although I didn't prepare any materials to talk to you today, those provisions can be found in section 8.076.2, subsections G, H, and I. So, for example, in subsection G, if a provider did not submit supporting documentation within the time limits prescribed by the department had the regulatory authority to automatically deem that as an overpayment. So we found that this provision was in conflict with Senate Bill 314, which requires a process by which we deem things an overpayment. And that process includes a lot of collaboration and work with provider stakeholders, such as for complex audits, there's an exit interview step whereby the parties get together and go over the findings. And for both complex audits and automated audits, there's an informal reconsideration step of review, and that's another opportunity for the parties to get together and really go over the audit findings to determine whether or not an overpayment should exist. And given those steps of review, subsection H required an interview process with the department. Well, Senate Bill 314 has its own review process, as I described. And then also the overpayment demand in subsection I. In the case of RAC audits, that overpayment notice comes at the end of the process after both the providers and the department have had an opportunity to review the findings. So we didn't want there to be any confusion between existing rule and Senate Bill 314, so we carved out 3 exceptions for those provisions that I described. I think going forward, as we resume these audits, the department will work together with you and with the physician advisory group to determine what sort of clarifications, what sort of gaps exist in our rules, and in the future we'll come back and promulgate a rule that really deals specifically with RAC audits. So Megan, that's all I had for the group today. If there are any questions, I would be more than happy to answer those questions.
Thank you, David. So I don't see any questions at this moment, but we can definitely circle back around. I want to jump in and have Chantel go over the updates from HMS as well as that beautiful website that you guys launched.
Thanks, Megan.
You're welcome.
All right. So as Megan said, my name is Chantel Kalish. I am the Senior Program Manager at HMS on the Colorado RAC contract. So as we have started mailing on our automated audits, we wanted to make sure, to David's point, there have been some things that have changed. So we wanted to make a few call outs as far as, things that we've seen as we've run some pilot scenarios. We've gone through a few mailings. So the first one being that automated audits start as a notice of preliminary findings. So in the past, we would send a letter saying, here are our actual findings. And then there was an opportunity for an informal reconsideration if you disagreed, and obviously the formal appeal. The process has changed in that we start with a preliminary finding. So we say, hey, this is something we identified is a potential overpayment at this point in time. And again, it moves on from there. So what we ask is at the preliminary findings, we did build in a new functionality into the HMS provider portal. And it's a toggle button functionality that allows providers to either agree with the preliminary findings that we've sent out or disagree. These instructions are outlined in the letter, so it's not something that you have to base off of memory today, but it is something that we do ask so that we can identify at the next steps whether or not preliminarily you agree with those findings or you disagree with them. Another big piece is the informal reconsiderations. So informal reconsiderations are now required in order for you to have formal appeal rights. And I apologize, I should have included that on my notes here. But informal reconsideration has changed as well. Informal reconsiderations are now a formal meeting where HMS staff, HICPUF staff, and providers would meet to discuss any of those claims that you did select that you disagreed with within that HMS provider portal. Those meetings are scheduled by HMS once you have either uploaded documentation stating why you disagree with the preliminary findings, or if you've utilized that disagree with preliminary findings toggle button. There are certain timings on both of these functionalities and how these claims will move through the process. So that is outlined in the training that I'll get to here in just a moment, but do know that we will expect that there is an informal reconsideration meeting and that each provider that disagrees does upload supporting documentation and reasoning as to why you disagree with those preliminary findings. That really helps HMS and HICPUF to prepare for the informal reconsideration meeting where we will discuss, what is the reason that you disagree. The point of those informal reconsideration meetings is really for us to collaborate, to have a discussion, and in instances, determine why each party, either agrees or disagrees with that as a preliminary finding. And at times we can walk away with an agreement saying, yeah, we agree with your reasoning and the supporting documentation that you provided. And in other times we will move forward with, hey, we actually did determine this is a finding, which would then give you the opportunity to participate in that formal appeal. And I did notice that is my second bullet point there. One thing I want to call out before I pull up the website, we do have a really great new website, as Megan said, and it's going to be updated as we go. We have just started mailing on some of these automated audits. And as Megan said, we'll start getting into the complex audits, DRGs going out here in a few weeks. So you will see updates to the website as we have scenarios approved, as we add additional trainings. But I do want to show you, what we have so far. But go out there. If there's something that's missing today that is then updated tomorrow, everything will be updated as we go. One big call out here is that our trainings that I had put together previously, if you've ever attended like a RAC 101 training session, those were previously updated on our website. Those will no longer be published on our website. Those will be published within the HMS provider portal. And as we get those updated, we will make sure that we have that information up to date on our website. So you'll be able to access that and really navigate to those trainings.
And it looks like we have a question, Chantel. Are you
Course.
saying the documentation has to be uploaded on the portal before the meeting as well as the toggle to yes, no?
That's a great question. So we do ask you to use the toggle button at the preliminary finding stage to, like I said, either agree or disagree. At the next stage, that is actually a notice of informal reconsideration. So after our preliminary finding stage, about 35 days following that, it triggers us to review, in the portal what you disagreed with, if you agreed or disagreed. It doesn't mean that your documentation has to be uploaded at that point. We will just work towards sending out a notice of informal reconsideration. Once the notice of informal reconsideration is sent out, providers then have 60 days to upload any supporting documentation that they have, as well as the reasoning why you disagree, and you can upload that into the portal. From there, the informal reconsideration meeting does have to be scheduled within 90 days of that actual notice of informal reconsideration going out. And so that documentation does have to be uploaded at least 10 days prior to your scheduled informal reconsideration meeting in order for us to have time to review that. Now, one thing I'm going to say is I just threw out a lot of dates or a lot of timeframes, a lot of deadlines. That is going to be published on the automated 101 training that is being published to the provider portal. Providers should have access to that as of Monday next week. I don't have the date offhand. I believe it's the 9th. So Monday the 9th, providers should have access to that training so that you can start, looking at those timelines, determine if there's any further questions that you have. But yes, documentation does have to be uploaded prior to that meeting. Any other questions, Megan?
It looks like we have is access to the portal and our website different? So as far as HMS's new website, I just added to the Colorado RAC website. At the top, there is a green button that says that will take you to the link directly to HMS's website. As far as the other part of that question, I will let her, Chantel answer.
Yeah. Of course. So the website is out there, that is public. So I will be sharing my screen here shortly just to walk you through the new website. As far as our provider portal goes, our provider portal has not changed. It will be changing just as far as like branding goes. We'll be making updates again to mirror the changes that we have made on our website to make sure that everything is consistent. However, if you have access to the provider portal or have had access in the past, you should still be able to access that. One thing I will say is I know we haven't mailed for a while. So if you haven't logged into the portal in quite some time, which we did run into some of our providers, you will have to go on and resubmit for access, or you may have to contact the help desk to have your access enabled back onto the portal. So it is the same provider portal that you were using before if you've accessed it in the past. And the website does have links for it. It also has a great training video for how to register if you have not registered for that yet.
And then another question is, which website will this training be on?
So the training for the provider portal on how to log in, how to register will be on HMS's RAC website. The automated 101 training would be within the actual HMS provider portal once you log in.
Looks like that's all the questions right now.
Okay.
I believe the host has the link though to the Colorado RAC website, and then I will put the link in for the HMS website that Chantel is going to go over right now. Oh, one more question. Where on the provider portal?
So I will put, I did realize that is not updated on our website at this point in time. I will make sure that I get those updated on the website, those instructions. But it is actually, when you log into the portal, the upper right-hand side, there's a little question mark and it says training and resources. You would go to that and then it would be under the training, and that on the left-hand side, there's a link for Colorado RAC, and that's where you would find that training. I will make sure that I get that updated to the website with at least a guide on how to get to that training that'll be published on Monday. Good question. All right. So this is our new RAC website. I'm going to go through it pretty quickly. I'm not going to, walk through everything, just give an overview so that you know what you can find on the website. As I said, there's going to be more added as we go and as we continue with our new mailings going forward. So you'll notice that across the top, we have new drop-down menus or menus that you can actually navigate to. So this is very different than what we had before, which was a landing page with a few different options across the left-hand side. The great thing about our website now is that as you navigate through these different menus or options up at the top, you can actually bookmark anything on our website. So if you want to reference something specifically and go back to it, it's not just a landing page that you go to and then have to reference, go through the left-hand side, select what you're looking for. You can actually bookmark anything on our website, as it does have a specific link associated with any of the information on there. The first page here is an overview of just the recovery audit contract. So this is not necessarily specific to Colorado, but what the actual recovery audit contract is, why it's in place, gives an overview. It does talk a little bit about HMS and who we are, but again, not specific to Colorado per se. As you go to the bottom, you will see that there are some resources where you can navigate again from the bottom to any one of these menus up here, these resources. The other great thing that I want to call out here is that we do have, accessibility requirements. We have our terms of use, a privacy policy, but we have all of the information right here, very easy to find, easy to locate, even though now we have different screens that each piece of information falls upon. If you navigate to overview, this is more specific to the Colorado RAC program, just a little blurb on what that is. And again, you'll see that at the bottom, everything stays the same. So if you were navigating through the bottom of that page or looking for something specific at the bottom, you can go ahead and navigate from each one of these screens as well. Process gives us a little bit more information, and this is one that I really wanted to call out. So as we have changed the process, this is another great resource for you to access information specific to the audits, the way that they're being run now. So there are different processes through the automated review process as well as the complex review process. These, this marketing is actually something that you can click on, and it is going to navigate you to each piece of the audit once you select it. So preliminary findings will take you to some information about preliminary findings. Informal reconsideration is going to give you information about our informal reconsideration process. Again, some of those timings are outlined on there as well. So if you didn't want to go through the full training, this is another great resource for you to be able to find all that information. And then again, I'll just show you that you can click on formal appeals for any questions you have there as well. Another great thing with this is we did separate automated and complex. So if you scroll down, you can actually see the limits that are outlined that came from the different bills that went in, or the bill that went into place last year. So you can see those limits outlined and the frequency of our mailing. And then again, similar to our old website, you can see those tiers based on what was outlined in that bill as well. Same goes for our complex process. So you're going to see another area here where we have outlined the steps from our complex review process. I'm not going to click on these. I think I showed you that in the last slide, but that works the exact same way. Click on any one of these steps. It's going to give you additional information and timing as to that particular step. Scrolling down again, you'll see the requirements for look back period, the limits, and then we do have another table down here that outlines those tiers and the limits for our mailing each month. If we go back up to the top, we have our scenarios. So our scenarios will be published all together. So you will see both automated and complex in this one table. The great thing is you can actually kind of sort these using the different arrow keys here, and it has the functionality to sort those based on provider type, scenario date, maybe when we approved it. And we also have a search function here. So if I'm looking for professional duplicates, I can start typing and you'll see that it'll automatically take me to any scenarios that have that language in there. Obviously, this is one place that you're going to see a lot of additions as we continue to mail. Not all of these scenarios have been mailed on just yet. Some of these are in a pilot process right now, and we have mailed, to a few providers. We're still getting feedback. We're still working through the process. FFS paid same day as encounter. That one's getting ready to roll out as a pilot, as well as behavioral health FFS. So you may see some scenarios on here that you're wondering, when will you be mailed to? One of the great changes that we made through this process is that provider services will reach out to you, regardless of if it's automated or complex, to let you know that we are getting ready to mail. The big thing with complex, as usual, is we are trying to verify mailing address for medical records. So please be looking out for those emails as we are getting everything started for DRG. I think we have already started that communication, gotten through that for our first round. But we will be continuing with that, in the next couple months and adding additional mailings. So just be looking out for those email confirmations from our provider services team that you will be receiving an audit mailing soon. Under resources, training, this is actually where we will publish any upcoming live trainings. So I do intend on still holding live trainings for Automated 101, RAC 101, whether it be automated or complex. So be looking out for those dates. We will publish those dates here. We'll work with Megan also to send out like an email blast when we're offering live trainings. Right now, we're just working to get those published on the provider portal so that everybody has access to them. They can access them whenever they have the time. I don't want to require people to, meet my schedule by having to attend a live training. So just be looking out for that, though. If you are interested in having a live session, attending a live session where you can ask questions in the moment, maybe have direct questions for me, I'm happy to help. But those will be published here. This is where the training video is. This will guide you to register in the portal if you have not registered in the portal. So there's a lot of different functionalities that we have been working on within the portal. One of those being the agree and disagree at the preliminary findings. That is applicable to both automated and complex. For complex, we have built in some functionality for exit conference. And so just want to make sure that you all are accessing the portal. If you haven't registered for the portal, it's very quick and easy. Once you submit all your information, it takes us a few days to get all your NPIs added, any providers within your network added onto your actual profile. But if you need help or assistance, there is this video out there as a reference. Under contact us. So very similar to what we had before on our website. One of the big changes that you're going to see is that a lot of communication as far as the audits go is going to refer you back to the provider portal. In the past, we did refer a lot of these different functionalities like exit conference to our provider services team. They still are there to assist, but what we're trying to do is help with, self-service through the portal where you all can, go in and select, hey, I want to exit conference directly through that avenue versus having to make a phone call to provider services. Again, they are always there, more than happy to help, but you will notice a few different areas where we are just referring you directly to the provider portal to do things like request informal reconsideration, submit medical records, exit conference, those types of functionality. Up at the top, you will see sign into the HMS portal. If you do click on that, it is going to take you directly to our HMS portal. Going back, if I click on the HMS logo, it takes me right back to the beginning. And so that is that. Go out there, take a look at it. If there's anything that you see, we're always happy to take recommendations. If there's something you feel would be useful for us to add to our website, what's really great is we created this so that we could make sure that it is something that you all can utilize that's going to benefit you. So we are absolutely open for suggestions if there's something you'd like to see on our website or something that would make it a little bit more helpful. All right, Megan, that is what I have.
Thank you so much. I'm going to open it up for some questions, and also it looks like Dr. Chapman joined us. If anybody has any questions for Dr. Chapman, we have the Q&A open. Again, I'm going to direct everybody to the websites. There's a ton of information. Like we've been saying, our Colorado RAC website is going to be changed and mirroring HMS's website, so the information is easy access for everyone. So I think I'll wait a little bit and see if there's any other questions. Do you have anything that you want to add, Dr. Chapman?
I don't have anything specific, but that's the
Sounds good. All right. So we did launch a poll, and if you missed that poll, Kelly has so kindly put in the chat that it's going to turn into a Google form for any suggestions, comments, what you guys want to hear at stakeholder engagement. I really, really, really encourage everybody to sign up for the provider advisory board as well. These are the two meetings that we have quarterly, and it gives a lot of information. They are recorded and on our website from the prior years and moving forward as well. It looks like one question came in. It says, the current portal will automatically be updated with the same access, correct? Access as in your password, or you could be more specific? I'm sorry.
Yeah, so it would be the same, like if you had access to providers previously, it will take anything that you had previously on there. So any NPI that you provided us in the past, your profile would still have access to all of that. If there's additions that need to be made, definitely reach out to our provider services team and they can get that added to your profile. If that's the question. Sorry, I don't know if there's additional clarification that came through.
They said yes.
Yeah. Okay.
So it sounds like, just a recap, Chanel, it sounds like they just basically need to get reset into the portal, but everything stays the same from when
Correct.
they were doing. Okay.
Exactly. So your access would have just been disabled based on the fact that you hadn't used it for so long. So you just have to have that activated again so that you can get back in there. So it just, after a certain period of time, we go in and disable it just because you haven't used it for so long. And like I said, we haven't mailed for a while. So a lot of folks, I'm sure, are going to run into that. So yep, if you just reach out to, you can follow the instructions on how to get that reset on the website, or provider services can help walk you through that as well.
And again, I'll just add in there, once you do re-enable and get that enabled, please update and review the current information moving forward so that we have information that's current for all providers. Okay, let's see. I still have access, so there will be no change. No, there's no change if you still have access to the portal. She was saying there's no change. You just need to update information or make sure that it's the correct information, Danette.
Correct. And any of the audits that we send going forward would have any of those functionalities that I talked about that are being built, that have been built into our provider portal. They would show up on each of your new audits. So if you go in there and you just don't see anything, it's just because there's nothing that you have that's been audited that's actually at that stage for you to utilize that functionality. As I said, the letter will call out everything as far as, the steps go in the process and the timing for that. So once you are selected for an audit, the letters will have very specific details on how to proceed with that particular audit.
All right, any other questions? And again, there's a Google form out for you to make suggestions or comments or concerns for the stakeholder engagements and what the providers would like to see. All right, well, it doesn't look like we have any other questions and people are dropping off the call. This is recorded and it will be posted in the next week up on the website, as well as the agenda and the slide. With that being said, everybody knows how to reach me. If you have any questions, you can contact me directly, megan.morehauser@state.co.us. And it looks like I can give everybody about 20 minutes back. I know our time is all valuable and we're all busy. And I look forward to seeing everyone at the Provider Advisory Board meeting next month. Thanks, everybody.